yeah, thank you very much for giving us the opportunity of this panel. I know it's late, 5 p.m., so I guess we all had a long day. I'm Paul. I'm an investment manager at Redstone. We are an early stage venture capital firm focusing on pre-seed, seed, early Series A across Europe. I am personally focused on our healthcare and education investments, so really, really glad to speak about such an important topic as healthcare infrastructure. And I'm also very pleased to have two amazing panelists here with me, with Patricio and Eduardo. So Patricio and I met today for the first time. Eduardo is actually a very amazing portfolio founder of ours. We've invested a couple of months back. It's been a great journey so far. And perhaps starting, I think, with a brief introduction. Patricio, who are you, what are you doing with To Do Well, and why you are here today?
Thank you, Paul. My name is Patricio Guitar. I'm from Argentina. I'm a co-founder of a new joint venture. It's a venture capital firm and a company builder. And inside this company builder, we're launching in a few months Todo Well. It's a platform where people can manage the journey of their well-being in a holistic way, in a smart way. We focus all on the stage of the well-being, from genetics, nutrition, movement, stress management, sleep, and supplements, complemented with AI. And we are expecting to launch the MVP in the next month. Thank you very much.
Yeah, thank you. Eduardo.
Thanks, Paul. My name is Eduardo. I'm a medical doctor by training. I'm CEO of Uphill. Uphill is the leading care orchestration platform in Europe. So essentially, we automate clinical pathways, journeys for patients in hospitals, and this results in the increased capacity of that hospital to serve more patients in a bigger population with the same healthcare team.
Thank you, Eduardo. Yeah, so perhaps starting, actually one of our investment hypotheses centers around healthcare infrastructure. So from our VC point of view, we see that the healthcare market right now is not in a very good state. You have massive cost pressure, you have a labor shortage, you have excessive waiting times. And for us, when we kind of compare the healthcare vertical with other verticals in terms of IT infrastructure, sophistication of the tech stack, and also like the way, data is being used, we see a huge opportunity. And, particularly with the rise of AI and LLMs, I'm quite sure you're quite familiar with that. That's something we watch quite closely and speak with many interesting founders every day and try to find the right investment opportunities. And but there are certainly also some challenges, right? Obviously, regulatory burden, GDPR plays a crucial role. There's also some kind of mindset, that typically people in the healthcare system, they want to minimize downside, they don't necessarily want to maximize the upside, they're somewhat cautious. Social proof plays a very, very crucial role. I'm happen to be the son of a rheumatologist and a psychotherapist, so I know what I'm talking about. My mom, for instance, is still like taking notes with a pen and paper and says, okay, I don't want to use anything digital because perhaps then I want to protect my patients, right? So that's a little bit of like something like a thing why, mindset plays a crucial role. And oftentimes, with many founders that we speak to also like in the healthcare infrastructure space, it's a very unique vertical in terms of go-to-market, right? So typically, like in other verticals, you have your CRM where you essentially try to map out decision makers and get just kind of cold calling them, and that obviously is very, very difficult to work with hospitals, with clinics, with practices, but also directly to therapeutics that work like independently. We're actually still quite bullish on the vertical. And perhaps start with some questions. What's your view right now on healthcare? What are perhaps the topics that you see or the trends? Perhaps broader in healthcare, but also related to healthcare infrastructure.
Yeah. Well, in one hand, our focus is to to improve and to boost the health of healthy people. We are in the preventing sector. You know, the healthcare sector is about diseases, and this is a big issue that they have to work. But we are on the other side to work on healthy people and to prevent chronic disease, for example. No? We are considering some forces. For example, the increase of chronic disease is a big problem. For example, in America, 80% of people that have more than 60 years old have one chronic disease that could be avoided. We have, and the 90% of this chronic disease is diabetes. 1 of 3 people in the United States is pre-diabetic or also is current have the disease. So, in one hand, we have a exponential growth of chronic disease in Occidental world. So, our point of view is to work on the prevention of these kind of diseases. And in the other hand, to take some advantage of not only AI, but the technology convergence and all of the work that a lot of doctors are doing in different countries. For example, the work of David Sinclair, then the discovery of the aging is a disease, of the work of Elizabeth Blackburn about the telomere tails, of the last work of Andrew Huberman about the impact of chronic stress, or also the enthusiasm and the motivation that brings the doctor of Mark Hyman talking about food is medicine and talk about the nutrition, and genetic editing of Jennifer Doudna of Berkeley. We have like a disruption in the well-being sector that we have to. I think we have to take the kind of movement to work with the chronic disease that we are facing. No? Yeah. So I think two kind of force. One is it's a big problem that we have to act immediately, and then the disruption of the sector with innovation and transformation.
Makes perfect sense. Eduardo, what keeps you up at night?
Yeah, so I think that there's this one definition that I once saw of the types of software there are around, and essentially are 3 levels: systems of records, systems of experience, and systems of intelligence, right? So the IT infrastructure, I would arguably say, it's made of 95% systems of records. And huge businesses have been built just by doing this. But if you think about this, it's quite short in terms of ambition, because it's essentially just moving a different format. So a few years back, hospitals, as you said, were still being run with pen and paper. And so huge businesses have been built just by transforming that pen and paper into a software, right? Mimicking the same old processes that hospitals were used to do over and over again the same way. So typically this happened to IT infrastructure, and software was rolled out, and minimal improvements were achieved, right? And so now, or at least a few years back, we moved into a systems of experience approach, in which typically we were much more focused on web portals and experiences for the patient. But these were not clinical. It were merely experiences that were improved with the mobile surge that we had, and so on and so forth. Right now, with AI, and not only with AI, but just with the pressure that we're feeling in the healthcare system, the IT infrastructure is moving towards a shift from these old systems of records that we have worldwide, like Epic, Allscripts. In Europe, we have many, like Cerner, CGM, and so on and so forth, to systems that are knowledgeable, which we call systems of intelligence. And let me just walk you through what a system of intelligence is and the effect it has on day-to-day clinical life. Essentially, instead of just taking record of what happened to a specific patient in a specific encounter, which is what mostly doctors do with software these days, These systems essentially are helping the doctor managing the course of disease of that patient. So we've been talking about chronic patients, and typically disease is not episodical. Disease is longitudinal, right? And specifically in chronic patients, once you're diagnosed, until the end of your life, you'll have to deal with your own disease, right? But the systems inside the hospitals and primary care centers and virtual care centers are still based on episodes, right? So they are completely unable to keep up with this nature of disease, this evolving nature of disease, and helping the patient, the physician manage the disease with decision support, with automation, anticipating proactively what should be done to a specific patient. And this has changed tremendously because of the pressures that you mentioned that we're feeling in the healthcare system. There simply aren't that many doctors, right? I don't know if you know the number, but doctors per capita have been the same around the last 20 years. And this has been coincidental with an increase in chronic diseases, earlier diagnosis of these chronic diseases because we have better diagnosing capabilities, more complex therapies to manage for chronic diseases, more multidisciplinary care, emergent diseases like COVID on top of all of this, so the system is simply collapsing, right? And so that's why the IT infrastructure in healthcare has felt pressure to really move towards systems of intelligence. It's because simply providers, essentially right now public but also private, know that they need to shift the care model and they need to stand on top of intelligent models like AI models, either deterministic or generative, in order to really enhance the capabilities of the physician, in order for patients to be followed up correctly and diagnosed in time and initiate therapies in time. Yeah. So I see that this shift is being tremendous in the healthcare system. And just to add a specific point, this is colliding with the current status of development of IT systems, for example, in the public sector across Europe, but also in the private, where we still have numerous hospitals with on-prem servers, without cloud running servers, without increased capabilities, for example, to hold the data they have and to make use out of it. And so I think there are tremendous opportunities in terms of disease management and to bring that intelligent disease management capabilities into the technological stack that the hospital uses day to day, because this is not happening.
Yeah. Okay. Perhaps I don't want to briefly interrupt you, so perhaps staying with you for one moment, right? I mean, we spoke about all the problems that hospitals face, right, and the somewhat like outdated IT architecture and some problems that also acceptance of doctors. What do you kind of do to still sell to hospitals, right? What is something, because obviously it's quite tough, and what perhaps is also like your return on investment mechanism and the story that you use, because I think that's oftentimes somewhat overlooked, is that, I speak with many founders that are like, hey, I have a great solution out there that works perfectly fine, but, sometimes founders forget that you need to understand who's actually the buying center of your solution and what's the return on investment case for this buying center and what constitutes success and actually to drive adoption. So perhaps you can share a couple of thoughts from your end and how you do that and what's the story and why does someone that hears like an elevator pitch of Apple Health in a boardroom somewhere in a hospital says, okay, it's a great idea to use them.
Yeah, I think that comparing with other software solutions that many SaaS, VC push, the product doesn't win. The best product doesn't win. What wins is the best distribution. So you can have a great product. If you haven't worked your distribution out correctly, it will not work, okay? Hospitals are very complex institutions, and doctors are typically very demanding with what they use. And so you really need to, if I'm talking about clinical software, okay? So there are other operational softwares around the hospital. I'm not talking about that specifically, but you need to tick all the boxes. You need to tick the regulatory box. You need to tick the use case box. You need to tick the IT compatibility box. You need to tick language, interface, minimal requirements, everything. Everything needs to be perfect. And I know this might sound disappointing to you because most of the talks that we hear around VC investment companies is that MVP is sufficient enough and let's go to the market and everything would scale based on that MVP. I would argue that's very, very difficult. So I can share some examples of what have worked out for us. For example, we have a very abstract software. So our software can run any type of clinical pathways, either preventative, chronic, oncology, up to surgical pathways. And initially, we were selling this software as a tool, wall-to-wall, for the hospital, okay? So hospital-wide implementations. And although this is very appealing for the IT teams and for the leadership, hospitals typically are run by physicians. They have immense power in hospitals. And so if you don't have a clear use case for that specific head of a department, that software will not be used. The board can approve it, the IT can approve it, the financial teams can buy it, but it will not be used.
And what happens then? They don't use it.
So we essentially broken down the software into very, very specific use cases for specific departments, and we market the value of those use cases. So essentially, for example, in surgery, we're talking about an increase in follow-up capacity and anesthesia workup of 2x or 3x. In chronic care, we're talking about reducing about 48% to 49% of rehospitalizations. And building this in terms of ROI for that specific department with clinical outcomes in mind is very appealing for these teams. And it's really what makes them switch and initiate interests in your software. And then it comes the thing of having all the box ticked. Then you need to go through the IT, you need to go through the procurement department, you need to have a leadership meeting, and all of that, you need to excel, right? But the core component of having a very clear use case defined with clear ROI for clinical outcomes is fundamental to get things rolling.
Yeah, oh, makes perfect sense, thanks. Patricio, I mean, switching to you, I understand, you know, you're also rather like B2C focused solution that you work on to do well. I mean, what's your return on investment case for someone thinking about prevention, you know, because, you know, obviously at one point, I mean, it's perhaps not super sexy, but monetization will also play a role to do well. How do you think about that?
Let me add some thoughts about about hearing quietly to Eduardo. We strongly believe that it's better to be a client than a patient, no? So we think that a new mindset is required in the sector, and we strongly believe that you are the CEO of your health, not your doctor. With the prevention medicine, I think we can help to the higher cost that all of the industry has. 60.6% or 18% of the PIB of some different countries are expended in the health sector. So I think this new kind of point of view will be a big disruption in the following years. So the monetization about the Todo Well, and we are preparing some kind of stage or phases or tiers of well-being. The product is high-level wellness. Yes, you can start wherever you need or wherever you want. In each stage, you have peer-to-peers, because it's a platform, it's a peer-to-peer platform with a lot of information, curated information, and a connection with the B2B suppliers. Because, if, for example, if your first step is to take a genetic test, you connect with suppliers and the monetization is about each stage, different price for each stage.
Perhaps, you know, asking, I mean, like the notion of having like rather also like a self-empowered patient, kind of having also control about like information. How do you ensure, let's say, quality of that information, and how do you perhaps make sure that the patient's outcomes are good.
Yeah, you know, when I started in exploring this field
Yeah.
to apply to myself, I found contradictory information
Yeah.
about in each field, very confusing information, a lot of information, different doctors saying different things,
Yeah.
and then the healthcare experience is not friendly. It's not
Yeah.
easy. It's not friendly. It's like the sector is a doctor-centered and not human-centered. So with this experience, we began searching for some solution. So what is one solution that we are very enthusiastic to implement? But you have to be careful with the information that you bring. Yes. And some tips or suggestions.
Yeah.
So what is it like a health coach? It's not a doctor.
Yes.
Yeah? Because the doctors have a specific place.
Yeah.
But you know, functional medicine doctors, there's like a new kind of doctors. There are not so many.
Yeah.
So there's no many time to talk about with a medical doctor. So we want to replace in some way the interaction with a medical doctor.
No, makes sense.
Also
I'm
not
too sure whether physicians would like that notion, but I get your point. I mean, typically, like the way we think about it is also like no one wants to be replaced by AI. Mm-hmm. Doctors don't want to replace by AI, but I think it's always very important to have this notion of like augmenting somebody to do the right thing, and essentially also getting rid of a lot of manual administrative tasks, non-medical tasks, right? I mean, for instance, I see a lot of startups that want to like get rid of everything that is like related to documentation administration, essentially use voice, for instance, or conversation to essentially completely automate it and actually use technology for the good. Perhaps in the light of time, Eduardo, I mean, if you, perhaps someone is in the audience that also wants to start a startup in the healthcare sector. I mean, you've been in the industry for a couple of years. You have numerous learnings. If you would perhaps pick one or two, perhaps most important learnings that you would tell a younger Eduardo a couple of years back, what would it be? And what's perhaps something that completely went south? And we would say, okay, I would not have done this mistake again.
Yeah, well, that's a good one. I think that the healthcare opportunity is great, right? So in terms of, it might be slower, but for companies to develop, but once they do, they have a huge moat in terms of retention of customers. For example, with healthcare infrastructure can be as lengthy as 15, 20 years of contracts, right? So this is unseen in other industries. So for me, I think coming from a background where I was a medical doctor who coded, I had this idea that just by doing a simple tool, it would roll out in the markets. So I think that advice I would give to fellow founders in the audience is never let your bar down when it comes to quality and completeness of the experience. It needs to be nothing less than perfect for it to work in the healthcare space. And it's very, very easy for us as the company grows. More people are involved into product development, more people are involved in distribution to let your guards and just assume a mediocre quality standpoint, and that's hyper dangerous. I've done it once. We raised the seed rounds, I've built the org chart for the ideal company, and it didn't work, right? It was the ideal org chart. Yeah. Everyone had very clear responsibilities, but it was not our company. And so focusing on the product and the distribution from a wholesome standpoint in which you want to control every aspect of it for it to be of high quality, requires an organization that's quite chaotic and quite unstructured. And so I think that focusing on high quality, wholesome experiences would be my take for you.
Yeah. So Eduardo never did a mistake besides drafting a wrong org chart. No, just kidding. No, very, very insightful. Thanks. Patricio, perhaps what are over the last decades of your experience? Perhaps start with the biggest mistake, and then what is like the key learning that you had during this journey?
Yeah. Okay. I think the big mistake is think so much on mistakes, because our brain is focused on the mistake, on the thing that didn't happen, so the bad things that we can do it, the ability that we don't have, the capabilities that we lost. It's like always we have seeing the empty glass, no?
Yeah.
And I think we have to focus on what we have, we can do, we can achieve, and put the purpose in the corner of every decision, in the center of every decision, and the strategy and all the processes of the company, and to feel like you are able to do a lot of things and to create a future for your capabilities and not only for the mistakes.
Yeah.
In the entrepreneurship world, we learn a lot from the mistakes. Perhaps we don't see the big achievement like a learning process. I'm not saying that we have to see what the people that have a lot of success. No, I'm talking about the things that you are saying to yourself.
Okay.
Yes? Because
to always keep a positive mindset.
Yes, it's positive
psychology.
psychology.
Didn't hear a mistake from you either, but no, it's okay. Just kidding. So all panelists, they don't do mistakes, It's a bit also just kidding. Great.
People from Berlin are a lot of mistakes. Do a lot of jokes. People from Berlin.
I do many mistakes every day.
Lisbon, and Buenos Aires and Berlin.
Yeah. No, great. I think we almost out of time.
What is your message?
What is my message? My biggest mistake. That's a good question. I'm asking that. No, I ask you, I don't have an answer to that. I think I personally, I have a business background. Obviously, I have like a family background and with doctors in my family, and I know the scene quite well. I completely missed the complexity of stakeholders and reimbursement schemes and who's paying for what, like initially big times. Mm-hmm. So when I was like 2.5, 3 years ago, I thought, okay, how can it be? It's not gonna be that hard. But then if I understood, okay, you have hospitals, you have doctors, you have healthcare insurances, you have kind of
federal insurances.
Yeah, you have, and then you have like on regional level, on a national level. Within Germany, for instance, then you have a cacophony of regulation across Europe, and it's just extremely hard.
Yeah.
And to kind of play that and not being essentially thinking, okay, hey, it's a great tech product, let's roll it out and it happens. I think that was like my biggest mistake, and that also resulting with us losing some money with an investment, Mm-hmm. But no, I think that's perhaps just one in this field. But many thanks for the panel, and thank you very much for the audience. Thank you.